Hey guys, my name is Dan, I'm a veterinarian, and today we're covering a blocked cat. Today I'm going to walk you through what a pet owner will probably notice at home, what I will do as a veterinarian to diagnose and fix the problem, and what to expect long term. Blocked cats are an emergency situation. If you or anyone you know thinks their cat is blocked, they need to go to the veterinarian ASAP. Usually the blockage is one of two things. It's either a stone or it is some inflammation or debris. If we progress from just blood to being blocked, that's when that stone or that mucousy, bloody buildup has formed a mucus plug, and now it can't get out of the body. So it just wedges itself in the urethra, and the kitty cat can't go pee anymore. What happens to the kitty is the urine builds up and it causes electrolytes to get abnormal. It causes the kitty to get azotemic, which is basically toxins that should be urinated out, start to build up. What the kitty does is they're really lethargic. They lay around. They don't move much. They don't eat. They may throw up because of all the pressure in their abdomen. Or it can be just not urinating or straining or complaining when they urinate. So when you roll in to see your veterinarian and my client comes in and sees me and they're like,
"Hey Dan, I think my cat can't go potty."
right away, if it's on the phone or in person, I am acting quickly. I have a look at their kitty and I do a couple quick things. Number one, I do a full physical. It's a quick full physical, but I want to make sure first that the kitty is stable. Once I do my physical, I put gentle pressure on the belly and I try to see how big and how painful the bladder is. In most cases, with gentle touching on the bladder, I can feel if it's like really small like it should be, or if it's a giant softball, just huge. So of course, guys, you're like, Dan, do your test, confirm it, and of course I will. I'll run some blood to see how bad the azotemia and the electrolytes are. And of course, I'll take an x-ray to see what's actually causing the blockage of the urine, which I'll discuss in 1 second. But more importantly, I need to decompress this bladder and get this kitty hydrated. I'm going to put a urinary catheter up there. I'm going to break up the plug so that we can go potty. And once we start decompressing, and I put an IV catheter in the arm to hydrate, I'm pushing fluids into my kitty, and they're peeing it right back out. So we're getting rid of the toxins, we're reestablishing healthy electrolytes, and we are saving this cat's life. If I have no bladder stones, this is going to be a medical case. We're going to be treating the kitty cat in the hospital, trying to get it feeling better. It's going to be all medical. If I have stones in the bladder, and they are obvious stones that just rolled into the urethra and blocked that kitty up, that's surgical. So if we have stones, as I mentioned in my previous video, that's going to be a surgical procedure to remove the stones. Again, talk to your veterinarian about what they want to do, how they want to approach it. They may not want to do surgery right away. Most of them want to do it at some point, and that's a good idea to do it if it's appropriate. But the major thing is getting the cat stable and then pursuing like surgery if we have to go that route. A lot of veterinarians will keep these kitty cats hospitalized for 2 to 3 days with overnight care, getting fluids in and getting fluids out. And by doing that, the veterinarian is going to dilute the urine out, and they'll hope to get all that mucus and blood and whatever else is in there out of that bladder. So right away, when we're collecting that urine, guys, it looks like fruit punch. It is gnarly. But by the end of our treatment, it should be crystal clear, and that gives me confidence, like a lot of confidence, guys, that it's not going to block back up again on me the minute I pull that urinary catheter out. So we've saved the kitty cat's life. We're going to go home. We pull the urinary catheter. We are peeing on our own. We're going to pull the IV because we're well hydrated. Again, if there are stones, we're talking surgery most likely. If there's no stones, we're talking,
How can we prevent this from happening again?
because I know it's uncomfortable for the kitty cat. I know it's painful, it's life-threatening, and it's a big financial burden to have to hospitalize a kitty for that many days and nights. We're going to want to do some food. And I go back to food again because we have seen a lot of benefit from using prescription food with kitty cats to dilute urine out, provide better pHs. It just makes the urine healthier and it prevents them from reblocking, hopefully. A cat can still reblock. There's no guarantees there, guys. But by doing a prescription food and doing meds either, short-term or long-term, from anything from anxiety meds to pain meds to bladder health meds like glucosamine, you can do a handful of different things to help improve, but having a healthy bladder is really contingent on a good food. So if we ever get blocked, do a prescription food, talk to your veterinarian. They will pick out the right one for you to do it long term, and then do routine spot checks on the urine. Alright guys, and if your cat's on a prescription food right now, please go ahead and let me know in the comment section which one it is. I'm always curious to see what the population of pet owners is picking for their blocked kitties' food.